not medications. But now, things were getting worse. A little bit, my knees started hurting.
So,
Better.
so you'd go other centers, you'd be given exercises. Were you given any medications previously? Or?
No, not medications.
So you'd have...
I've been just doing, exercising and, but now, things were getting worse. The back and, walking and everything was affected. If I walk a little bit, my knees started hurting.
So how long was a little bit? How long would you walk before you'd start feeling issues?
Well, I used to walk the whole round, but by the end of it, my knees are so tight that I can't, walk properly.
I see. So that would hinder you. What about things like at home, either cooking or cleaning in the house?
Cooking, I used to be in the kitchen, stand for a little bit more time, and then, my knees were having problem. Back used to pain a lot.
Okay.
But
so then, what was the trigger that made you think I need to find something else? I mean, how did you find me? What did you?
I went online, looked for a good chiropractor, doctor, and I found you. I saw the reviews, and I also told my daughter to check it up, and she said, "Mom, he's got the best reviews." So that's how I ended up with you.
Okay, and how have you found your progress here to be? Well, what is?
I am very happy. I would say, up till now, about 80-90%, I'm better.
Wow. And you say that number because what is different in your body? What are you noticing differently in how you're moving?
My walking, it has become faster. I can walk faster. The pain in the back, it's subsided. And even the, the pain in the thigh and, from the back, it has actually diminished, I would say.
Wow. And it happened pretty rapidly, hasn't it? It started to...
Since we have started the treatment.
I mean, we started treatment. I mean, you're coming in to correct and to keep the body balanced, but even before, I mean, it started to happen quite soon. I mean...
After the treatment, there were days when, it used to be paining because the body was healing.
Yes.
But now I've accepted, I've been doing I've gone for that lumbar, the exercises at night, in the morning.
Yes.
I've gone to 17 minutes.
Wow. So you've actually been, in addition to the corrections, to support this care, you've actually been doing home traction, haven't you, with the tractioning? And that's to help support and create that good curvature and the good alignment in your body. So we actually want you from the inside to be better.
So now I've reached to 17, I have to reach to 20 minutes.
Yes, wow, excellent. And we started from baby step, we started at 2 minutes, 3 minutes, and your body is, well, it's a clear sign it's getting stronger.
I feel good.
Wow.
Thank you so much, Dr.
Thank you so much, and you've been so kind to recommend to other people. I mean, what would you say? Because we do get people from, sometimes they feel from other countries, and they're trying, they're not getting the benefit.
Yes.
What would you advise people who are overseas? Do you think it's...
Definitely, I would say to come to you. And if really somebody is suffering, I would 100% I would advise them to come to you.
Because you've seen the benefit, huh?
Definitely, 100%.
Well, what are other people noticing, like family? So are they noticing? Is it only you that feels, or other people?
Even my family, they've noticed that. Oh, Mom, you have not been. Complaining that my knee is paining, this is paining.
Mom's happy, then everyone's happy.
Definitely.
Good. Well, it's been a pleasure, madam. You've been so diligent. You're a pleasure to have, and each time we come and we meet, you're pleasant. You've been so kind. You've brought us gifts and cooking and gifts, and such lovely things. So it's been absolute pleasure having you, and God willing, long may this continue, and we continue.
I will be coming for touch-ups every
That's
few
what it's
months.
about. Yeah. I mean, it's about just once your body's balanced, just keep it.
Oiling and
it.
greasing.
That's it. Just
Yes.
keep oiling and greasing and keep the body tuned at a
Yes,
higher level.
definitely. I will.
Great stuff. Much appreciated.
Thank you
madam.
so
Thank you,
much.
madam.
Thank you.
Thank you.